Wonderful. First up, I'd like to introduce Kelly Richards, the President and Director of the Free Library of Philadelphia.
Hello everyone, my name is Kelly Richards. I'm the new director, 14 days, of the Free Library of Philadelphia. I want to thank the Health Commissioner, Cheryl Bettigal, and to the Philadelphia Department of Public Health for organizing this event today and for being excellent partners with the Free Library. My first weeks as President and Director of the Free Library of Philadelphia, one thing that is incredibly clear to me is the dedication and hard work of our library staff. They're awesome. The dedication makes our neighborhood libraries a safe place and a safe space for our communities, and that dedication extends beyond the walls of our buildings, and it has helped improve and even save lives. Many staff members have taken Narcan training and offered training at their libraries to others on its use. And we have many documented instances of them putting the training to use in a time of crisis. Within the library system, since October 2015, there have been over 54 reported incidents concerning overdoses. In 41% of those instances, it was the Free Library staff who administered Narcan to individuals in need. Along with library staff members attending Narcan training, they have participated in naloxone distribution day events, collaborated with city departments to learn more about the city's opioid strategy, and distributed Narcan kits to all 52 neighborhood library locations. The administration of Narcan has helped many of our community members by reversing the effects of an opioid-related overdose. Narcan has saved lives, and I thank each and every Free Library staff member for their critical role in administrating Narcan or hosting a program training on it. Library staff have worked diligently to find creative solutions and ways to support those experiencing overdoses and acting with kindness and compassion. Over the years, library staff members created meaningful community partnerships to address the opioid epidemic and became advocates for local communities. Having Narcan Near Me Tower outside of our library is a special opportunity to provide no-cost and low-barrier Narcan to those experiencing overdoses and help save lives. So working within a larger network of community organizations, Lucien Blackwell, West Philadelphia Regional Library staff is committed to showing up. Staff members have advocated for Narcan distribution within local communities, and I extend my sincerest appreciation to Nana Minoe Regional Librarian at Blackwell Regional Library for her tireless diligence, which she has shown through her constant collaboration with her colleagues in her community. So I want to thank you to the entire library staff at Blackwell Regional Library for their steadfast commitment to meeting this moment. I also extend my thanks to State Representative Rick Krajewski, who is present with us today, and to the city for its continued support. Now I'd like to invite Health Commissioner Cheryl Bettigal to the podium. Thank you very much.
Good morning, and I want to thank Kelly so much for having us here today at the Blackwell Library and for this event. I want to particularly thank Jose Caraballo and Rachel Russell and the rest of our team from the Division of Substance Use Prevention and Harm Reduction for their work to make this event possible and for all they do to fight overdose deaths every day. Since 2017, Philadelphia has been fighting rising overdose deaths due to the spread of fentanyl and the heroin being sold in the city. At first, it mainly affected those in Kensington, and the city stepped up and worked to get overdose reduction tools poured and resources into that community. And to some degree it worked. Overdose deaths in the Kensington area have dropped and are continuing to drop. But something else happened. Fentanyl started showing up everywhere, even in drugs that are not heroin. This means that people who aren't used to the powerful effects of fentanyl were being surprised by it and dying from it. West Philly is one of the places that has been hardest hit by the fact that fentanyl can potentially now be in any drug. The thing that makes this changing drug supply dangerous is that places like West Philly don't have as many resources as they need to combat this deadly drug. We need to take action today. We need to make sure that people here in West Philly have free, easy access to Narcan. As a reminder, Narcan, which is also called naloxone, is an opioid antagonist. It's not an opioid, and you can't get high from it. You can't sell it as a street drug, and it's not dangerous. All it does is temporarily block the effect of opioids. It does the opposite of getting you high. What that means is that it can and does literally stop an overdose as it's happening. It's life-saving medication that anyone can walk into a pharmacy and get without a prescription because of the state's standing order. That doesn't mean it's easy to find, and it doesn't stop stigma from being a barrier to buying Narcan. That's why we're here today, because we've found a new and innovative way to start to get Narcan into West Philly. Today we're announcing a new program, Narcan Near Me, that's free, easy to use, anonymous, and will save lives. Today, anyone can walk up to the tower here at Blackwell Library and soon at 60th and Market Streets and get free, life-saving Narcan. Carrying Narcan can save your or someone else's life. Why wouldn't you carry it? To learn more about Narcan, including free training on how to spot an overdose and reverse it, please visit phillynaloxone.org. Next, I'd like to invite State Representative Rick Krajewski to the podium. Thank you all very much.
Good morning, everyone. I'm State Representative Rick Krajewski for the 188th District. I'd like to start off by thanking the City Department of Health and the Free Library of Philadelphia for being important partners. I want to thank the staff here, particularly at the Blackwell Library branch, for being willing to be leaders in this important project and for allowing me to participate in this extremely important announcement. As our city and state continues to struggle with a raging opioid epidemic, the installation of this Narcan tower in West Philadelphia has the potential to save countless lives, which would have otherwise been lost to overdose. As someone who has loved ones who've battled addiction, I've come to understand that it is a challenge that has no simple solution. No one chooses to become addicted to opioids. No one chooses to overdose. A person can choose to take a path towards treatment, towards recovery, but that person cannot walk that path alone. The war on drugs devastated our Black and brown communities, which saw the focus of policies that pushed towards incarceration and enforcement rather than supportive services. Carceral spending went up while public health spending was slashed. An entire generation of people were ensnared in a cycle of desperation, addiction, then imprisonment. And yet, our communities were not safer. Drug addiction still proliferated, and 30 years later, we're facing a similar crisis. In 2020, 1,214 people died from accidental drug overdoses, the second highest total ever in our city. People are increasingly using drugs that are being cut with powerful opioids like fentanyl, with pills that are fashioned to look like pharmaceutical medications. People whose addictions may have started with relief for a back injury are unknowingly taking drugs that are exponentially stronger than what they started with. One of the issues our Black community in West Philadelphia has with this is, why are we so concerned about the opioid crisis? a crisis largely painted as one affecting white Americans, while public officials stood by as the crack epidemic plagued us. I know this pain firsthand, and my response is that this is no longer just a white American issue. In 2020, drug overdoses amongst black and brown people rose, while overdoses amongst white people went down. Lives are being lost every day because of our unwillingness to change how we address addiction. Some of us may be uncomfortable with that. Some of us may not like the idea of seeing the harsh reality of addiction, but I'm begging you to hear us out, to listen, to have an open mind. Because if it's between my own discomfort and preventing another person dying, I'll sit with my discomfort for as long as I have to. My hope is that the installation of this Narcan tower can be a start of not only harm reduction, but also the start of a conversation of what else needs to change if we're going to beat the opioid crisis. We have to hold the pharmaceutical industry accountable for its profiteering of pain and suffering. We have to provide people with accessible treatment centers, with good jobs with a livable wage. We have to divert people away from mass incarceration and towards proper reentry for those that are coming home. None of this is going to be easy. But all of us can look around and see that the status quo is not working. I'm committed to my role as a state representative in investing in our communities. I know the hardworking people at the Free Library, particularly this branch at the Blackwell Library, and the Department of Health are committed too, and I ask that you join us in fighting for better solutions. Thank you.
Next up, we'll bring Corey Yantha. He's CEO of Dispension Incorporated. He's the company that makes this. Name is spelled C-O-R-E-Y, last name Y-A-N-T-H-A.
Good morning, everyone. Thank you to Kelly Richards, Councilman Member Gauthier, Dr. Bedigol, and Representative Krajewski, and members of the community for inviting me here today. I would also like to especially thank the harm reduction team for all the great work that they do. It's so wonderful to be back in this city, and especially at this time of year. Dispension is incredibly proud to support the Philadelphia Department of Public Health in this important harm reduction initiative. We are absolutely honored to work with the people of Philadelphia to help fight the overdose crisis here in the city of brotherly love. Dispension is committed to making communities safer by responsibly improving access to restricted products, and in this case, life-saving medications. Our technology empowers people, giving them more autonomy and freedom to get the help they deserve. In a harm reduction capacity, Dispension is helping to destigmatize treatment and save lives. We have a proven track record, credibility, and experience. Our harm reduction kiosks have seen more than 10,000 transactions in multiple cities across Canada. That's 10,000 times that people were able to safely access the medications they needed. This new partnership with the Philadelphia Department of Public Health is the first of its kind in the United States. We are certain this program will be successful, and we hope to expand our footprint throughout the city, the state, and the country in the near future. The Narcan towers that are part of the Narcan Near Me program are state-of-the-art. They are 400 pounds of high-grade steel outfitted with bulletproof features for added security. They are safe, and most importantly, they are easy to use. People using the Narcan towers can access the medications in seconds by simply tapping the screen. And in the case of an emergency, the kiosk can connect directly to 911. The goal of this technology is to improve access, to improve treatment, and to make the process simple and secure. These machines are for everyone. For bystanders who need to help someone in an emergency, or for someone who wants access to take-home medication because they or someone they know and love is at risk. If our technology can make Narcan more available and accessible to people who use drugs, their communities, and their family members, we consider that a win. This technology is inclusive and accessible, featuring both audio and visual aids, and it's ADA compliant for those who use wheelchairs and have other mobility challenges. I'm pleased to say that our technology is not only offering practical healthcare solutions, but we are also helping organizations gather information to better inform the policies and programs for the best possible outcomes. The goal is to make Narcan more accessible for everyone. I've said it, but it's worth repeating. Our technology is saving lives and making communities safer, and we are proud to be doing just that here in the great city of Philadelphia. Dispension is disrupting the way restricted products are managed and delivered. We are providing safe and secure technology solutions throughout the world, and we look forward to continuing our work together. Thank you very much.
Thank you, Corey. All the speakers are available for questions. Questions from the press.
Obviously, this is the first one of these that's been put in. How many more are there going to be? Where are they going to be? Is there a cost to the user?
Probably Cheryl. Do you want to do those?
Okay. So we have plans to install a second one in coming weeks. What will happen next depends on both funding and use. So if this is something that the community uses, if we're actually getting doses into people's hands this way, which we expect to do, then we're going to be trying to do our best to expand this around the city.
Is there a cost to the user that
There is no cost to the user.
Okay.
No.
And will somebody be able to go over and
After
kind
we're
of
done
show us
Q&A,
how it
we're
works?
going to do a walkthrough.
Okay.
Yep.
How is this funded?
It's through grant funding right now.
So each one would need to be.
I mean, we will figure it out. That's kind of what we do.
Where are the grants coming from?
This is a CDC grant.
And you said earlier that depending on how many people use it, you'll pay looking for funding for somebody else. How long are you going to wait to see the amount of use to calculate the uses?
So, we'll have to see what happens in the next few weeks and few months, but it depends what we see happen. I'm hoping that there's an explosion of interest, that people suddenly understand there's a really easy, no barrier, stigma-free way to get this medication, and also that your folks' coverage of this will help people to understand. One of the most common things we hear from families after somebody dies from an overdose is that they had no idea that person was using opioids. It's very possible that that person had no idea they were using opioids. Maybe they thought they were taking cocaine, and the cocaine was laced with fentanyl, and they overdosed and died. So we want this everywhere. So it really depends on what happens next. We're going to do our best to promote.
Why did you guys choose this place as the first place to start this program?
So West Philadelphia, although it doesn't have the highest rate of overdose, it has the highest rate of increase in overdose deaths. So what we're seeing is a problem that started in one area of the city, just spreading all over the city. And we don't have the Narcan distributed out here yet, so people don't have it in their possession.
What kind of metrics are you collecting to be able to measure the usage?
So we are able to look at the number of doses that get used, but there's actually a built-in survey. If people click emergency, they just get the Narcan. But if people say it's not an emergency and they're just getting a kit, there's an optional survey they can fill out with some simple demographics. So, for instance, what zip code do they live in? What age are they? So we, depending on how many people fill out that survey, we hope to have a little bit more information about who is using this.
And one more, sorry. Was there any sort of regulatory change that needed to happen to allow this? I mean, I know there's a standing order for Narcan in pharmacies, but did anything have to change to make this possible?
No.
How many Narcans are actually in the towers?
I believe there are 20.
When we could talk to JC over there.
Yeah,
we can get to
JC
that
will walk you through. I
details.
think it'd be great to actually be able to show the unit. So.
I'm not sure if you said numbers or not. Do you know how many overdoses there were, opioid overdoses in 2021 in Philadelphia?
In terms of deaths, we're on track to exceed 2020. So it's going to be over 1,200 in 2021. We can get you the exact number. The overdoses, as opposed to overdose deaths, will be significantly higher than that.
Any other questions, folks? Last call. Thank you very much. Cameras, give me a second.